Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We always talk about a different healthcare topic every time. Hopefully it's useful for you. Today, we are talking about dry needling, which really piqued my interest. Just the mere words of it sounds very intriguing. So I'm very happy to have Tara Haley here with us. Thank you for being here.
Thank you.
You're the Director of Therapy over at Magruder.
Yes.
So I know you're busy. So again, thanks for being here.
No problem.
It's something we've been talking about, all the different modalities in therapy and how it's expanded so much, and there's so much more to it than probably most people realize. But one of the things you mentioned was dry needling, and I was like, what? So what is dry needling?
Well, exactly that. It is a therapy modality. It can also be used by medical doctors and chiropractors and different people who have licenses and are certified to do the dry needling. But basically, it's a technique that can help with pain, help mobility, and it uses these tiny little needles, and those affect the body to help improve that function.
So this is not necessarily something that you can watch a YouTube video on and be like, okay, now I know how to do dry needling?
Absolutely not. Actually, for physical therapists, you're required to have 50 hours of hands-on training before you can be certified in dry needling.
Okay, so doctors, including chiropractors, therapists can do that kind of stuff.
Correct.
And so talk about the needles, because you know needles come in a variety of sizes and shapes and all that kind of stuff. So are they big, giant?
They can be.
Okay.
So I brought a couple today, and these are a little bit smaller sized needles.
Okay.
Basically, the needles are extremely fine. So they're monofilament, teeny tiny needles. And they come in a tube. In this case, these are sarin needles. That's a certain brand of needle.
Okay.
And they come in that tube. They come with a little tab on the end, and then they're individually packaged. So these are sterile needles.
Not like out of my sewing kit.
Nope, you can't use the sewing kit. You can, but we wouldn't recommend it. So they come in that little tube, and basically how the therapist or the medical practitioner uses them is they will take them out, they'll put the tube on the skin, and then they'll hit the tab, and then that tab will kind of not inject, but it'll send the needle into the skin where we want it to be.
And you said it helps pain. How does it do that?
So there are several mechanisms that the dry needling works through, but basically it can work on the local level, so right where we insert the needle itself, and the systemic level, so the whole body. So with that local level, what happens is that needle goes in and it causes a physical stretch. So the needle goes in, it pushes that tissue around, and then it also causes a lesion, as you can imagine. So that needle goes in, it pokes, causes a lesion in that tissue, and then that helps to spur on the inflammatory process. So a lot of times with pain, people don't always realize this, but what's happened is that inflammatory process has actually gotten stuck. So your body is now used to that pain.
Gotcha.
And it's no longer healing. So we insert this needle, it causes that lesion, it reminds the body, hey, we got a problem here. And then all those good chemicals and everything come into that area and they help heal it again. On the systemic level, so the whole body, it's also affecting things like your lymphatic system, so how things are draining, and then also the endocrine system. So what it can do is it can increase endogenous opioids. So endogenous opioids are basically the feel-good chemicals. So then it does that on the whole body level, which is extremely beneficial with people who have those chronic conditions, those pain things that just are not healing.
I'm assuming, are they sterile needles?
Absolutely, yes.
I know they're packaged and all that, but I wasn't sure if that meant that they were sterile.
So with the process, they make them sterile before they put them in those packages, and then since they're individually wrapped, we can unwrap them by themselves. We're wearing gloves, following all sanitation procedures, infection, all of that. So.
And it's also called dry needling. So dry. So obviously there's no. It's a dry needle, just like it said.
The needle is dry, but also this is in comparison to wet needling, which is not an approved physical therapy technique. And that is where you're actually needling to the point that you're trying to get a blood response. So we don't go that far when it comes to therapy, although you do occasionally get minor specks of blood, that sort of thing. It's not to that degree, so that's why it's considered dry.
I was going to say, do you get... I mean, are you covered with Band-Aids when you're done? Or
No. We, there's one Band-Aid in my kit just in case. But I've never had anything more than just a speck.
So how does a person feel afterwards? Are they like, ooh, I've been poked, or?
Yeah, it's extremely variable.
Okay.
So it can be everywhere on the spectrum from you're feeling a little bit dizzy afterwards. I had one person get nauseous, but that's extremely rare. The more typical is you feel a little bit of a poke, you might get a little bruise from it, and you'll notice something happened but not feel too different. All the way to you get people who have this adrenaline response to it, and they're feeling jazzed up and ready to go. So that's one reason it's really good for sports. So there are some individuals who they'll have this done if they have a sports injury, have it done right before they go do their sport, and then they're good to go.
To relieve the pain and, okay. Now it looks, when you see pictures of it, it looks like acupuncture. And I'm sure there's some similarities, but talk about how they're similar or how they're different.
Absolutely. So acupuncture is based on traditional Chinese medicine. So this started 2,500 years ago. It's based on the meridians of the body and the qi. I'm not trained in any of this. I only have a base knowledge of it. But that's what acupuncture is based on. So dry needling uses the same medium, the needles, but it's not based on the same philosophy behind it. So instead, dry needling is based on the neuromuscular system and the musculoskeletal system. So where are the muscles, nerves, joints, bones, and that's what we base it on. But the really interesting thing is they find that both have benefits. So you get benefits from acupuncture and from dry needling. And if you look at it, and I've looked at some of these charts of the meridians, they line up pretty closely with where the nerves run. So if you think of this as almost like a nerve block, but with you're not injecting anything, it makes sense that those two could both work, just in different ways.
So this is to chronic pain, even acute pain? I mean, while they're trying to figure out what the acute pain is for, just arthritis or
there's
injury.
a large spectrum, so it's not going to fix any arthritis. It could help with
if only it did.
Right, if anything did. But it can help with some of the symptoms that come from it, that pain response. The larger issues that it can help with, the more beneficial, are things like if you have muscle trigger points. So if you have little nodules, like a lot of people get it right into this upper trap muscle, right on top here. That's one of the best areas to needle, because you can get it in there and actually get muscle twitches, where the muscle twitches and then it releases. Yes, exactly. So trigger points are great. And then different types of conditions like golfer's elbow, tennis elbow. Those are really good conditions to do. Headaches, TMJ, if you have issues with your jaw. So there are a large variety of things that can help with.
Do you use like one needle at a time or a handful of needles at a time?
So there are different techniques behind this. Yes, it'll depend on the condition, but also on who you're trained by. So I was trained by the integrative dry needling approach. And one of the things that we learned is that another way that it differs from acupuncture is acupuncturists will leave the needles in for 15 or 20 minutes. What we learned is that basically you've created that lesion as soon as you put that needle in, so you can take it right out. So my personal technique is you can use the same needle 5 to 6 times
on the same person
before it starts to lose its sharpness. And you don't want to use a dull needle, because that's very painful. So about 5 to 6 times. So I tend to use the same needle, take it out, and then move on to my next spot. Other people, they'll put in several at a time. It's just kind of a technique thing, and how you operate. And then there are also different techniques. So depending on what technique I want to use. If you want to put the needle straight in and take it right out, that's usually what I start with, to make sure that it's tolerated well by the patient. But there are also different techniques like flossing, where you'll insert the needle and then you'll take it slightly out, change the angle, and bring that needle around, so you can create a bigger lesion with that if you need it. There's also an interesting technique called winding, and winding is where
winding in a needle doesn't.
It's kind of like if you're using a fork to pick up spaghetti. So you insert the needle and then you twist it, and it spins the spaghetti around, basically. So that's another really cool technique that we can use.
Is this kind of a one and done thing, or just kind of probably like everything depends on the person or the
It
condition.
does. So it depends is my favorite phrase in the medical world. It depends. So some of these conditions, sometimes the tennis elbow, the golfer's elbow, one treatment we're good. Maybe three, up to 3 treatments. And then there are also those chronic conditions where you might need to do this 3 times a week for several weeks before you're seeing a big change.
And can it be combined with, if you're seeing a pain management doctor, if you're getting, therapy or that kind of stuff, there's
Absolutely.
precautions or anything like that?
So there are precautions, but those relate more to any other conditions, if you have bleeding disorders, that sort of thing.
Oh, gotcha.
But yeah, absolutely can be in conjunction with other treatments, other disciplines, that sort of thing.
Okay.
But also even just in the therapy world itself, it can be combined with the exercises that we're doing, and it also can be immediately combined with something called electrical stimulation.
Okay.
So that's where we actually attach electrodes to the needle. So you'd have 2 needles, one here, for
Okay.
example, and then you'd have 1 electrode here, 1 here, and you actually send an electric signal through the body. This is a pain relief thing. I know it sounds like torture,
like a pain creating, but yeah.
but it's not. It actually feels really good. It creates like a little massage type.
I was just going to say, it's like an internal massage.
Exactly. So it'll kind of bounce those muscles around and give that pain relief through that.
Oh, and that's an option too? Mm-hmm. Does a person need like a physician's order or a nurse practitioner order to do something like that?
So at Magruder, we do require a physician's order for this. In the whole world, through physical therapy, we actually have what's called direct access. So you can go straight to a physical therapist and get this if it's okay with them, and all the other things you have to consider, like money and
Sure. Yeah.
all of that. But at Magruder, we do require that physician's release so that they know that you're coming, and then
Just
if
that
you
you're
do
getting it
have
done.
those other issues, they can let us know.
If a person doesn't have a primary care provider, can they refer themselves? We're not sure. We need to figure that.
That's where the direct access would come into play,
Okay.
and you would want to find a physical therapist who
Can do that.
And it doesn't have to be primary care physician. It can be pain management physicians. They love dry needling.
Yeah.
And then we get a lot from our orthopedic
Oh,
physicians as
Because
well.
a lot of that is
All related.
orthopedic related
Absolutely.
pain.
Absolutely.
Okay. So insurance, no insurance, because I know sometimes that can be
Yep.
an obstacle or just a hoop to jump through.
Right. It can be a barrier.
Yeah.
So again, with the direct access, people can go get this right away. Obviously, they're not going to get insurance coverage, depending on what goes on with that, because insurance typically requires that physician referral.
Okay.
The big thing with insurance right now, so the way that therapy is billed is on CPT codes. That's how we submit this. So when I started studying this in 2013, there was no dry needling CPT code.
Okay.
Now, as of a couple years ago, there is.
Okay.
Now. However, just because you have a CPT code doesn't mean the insurance is going to pay for it. So it all depends on the insurance itself. Medicare does not pay for it currently,
And a lot of
although we're
insurances
pushing.
kind of go with what Medicare does.
Exactly. So there are a few that cover it, but not all of them.
Not very many.
Now at Magruder, we simplify this, so we do it on a cash basis.
Okay.
So it's $50 per treatment, and it doesn't go through insurance at all. Even though it's the $50, even comparing to insurance, if you're looking at that, oftentimes even when insurance covers it, you're still looking at a coinsurance, deductible, all of that anyway.
And I feel like insurance sometimes takes a while to catch up to, like massage, I don't know, just probably physical therapy at some point was kind of like, ooh, that's so new and weird, we don't know.
Absolutely.
So yeah, it just takes time for that all to catch up and to be.
And our professional organizations are working diligently at that.
Yeah,
and,
to show that it's legitimate.
It works.
It's not Billy Bob's dry needling.
Absolutely. And it's backed by research. So there are lots of research studies out there that support both acupuncture and dry needling.
Anything else you want to share? Anything else you're like, I wish people knew this about dry needling?
That's a great question.
You just probably wish they knew about it.
Right. That's the biggest thing is people, what is dry needling? So just getting the word out there, I think, is huge, and all the different things that it can help with to make people's lives better.
Do you have people that needle averse or have a phobia, maybe it's not, I mean, if they have a real phobia where
Sure.
it wouldn't be recommended, but I mean, have you had people come in and they're like, listen, I really don't like needles, but I kind of want to do this?
Yeah, it's never those people who have a true phobia, they won't do this.
No, not for them.
But those people who are kind of like, okay, you're going to draw my blood, I got to look away. Actually, that's me.
Right. Yeah.
They're okay with it, and
Right.
they're like, hey, just tell me. And we're just more cautious with those people. We let you know, okay, this is when you're going to feel the needle, you're
Yep.
going to feel a stick, and you warn them.
Right.
And then as soon as you do the first needle, they're like, oh, the needle's in?
That's not that. Yeah, it's a
I
pretty,
didn't even feel that.
pretty teeny tiny. So
Right.
Awesome. Thank you very much.
You are very welcome. Thank you.
All right. So there you go. A little bit of information, actually a lot of information about dry needling, well, it's new to me, maybe to you too. So whether you know somebody who could benefit from that or whether you could yourself, like I always say, I encourage you to share the information. If it seems like it might be applicable to somebody, you can always reach out to me at the hospital or Mrs. Pels here at the high school if you have a suggestion for a topic or an episode sometime. And until we meet again, I encourage you to make time for health.